Harbor Park CrossFit, a show dedicated to helping you find enrichment for the other 23 hours of your day outside of the gym. Here's your hosts, Jason, Dave, and Corian.
Good afternoon, ladies and gentlemen. We're back. Episode 46 coming at you. Anchored at Harbor Park here. I'm Coach Jason.
I'm Coach Dave.
Coach Corian.
And today we have a special guest with us. Tyler from Bedogne Chiropractic is here. Tyler, you want to just tell everyone about yourself?
Sure. Thanks for having me on the show today, guys. Like Jason said, my name is Dr. Tyler Vidstum. I am a chiropractor at Bedogne Chiropractic in Kenosha. Been there for almost a year now, and been really enjoying my time here so far, getting to know everyone, especially you guys here at Harbor Park. It's been a good time.
Very cool. What's your favorite thing about practicing?
My favorite thing about practicing is really just kind of the results you get from each different patient. You know, each patient kind of requires a little bit different care, and seeing those outcomes, even the unexpected things like the visceral improvements people get between their stomach issues, digestive issues that maybe you didn't intend for them to improve upon, but throughout the course of treatment, you get some really good surprises and results.
Well, if you guys couldn't tell, I suppose I should have said this first, but today we're talking about chiropractic care. We're going to talk about a little bit about what it is, why it's important for everyone and not just CrossFitters, but also why it's important for us as well. So I like to touch on the fact that Bedogne Chiropractic is our preferred provider for our Kenosha clients. So we wanted to come in. We've all introduced you to Eddie with Daniel's Chiropractic, so we wanted to make sure you guys are introduced to Tyler as well. So with that, Jason, you want to ask him the first question? Why don't you just kind of tell us about chiropractic care? Some of our members might not know what it is or might not have the correct understanding of it.
Okay. Yeah, that's a great question. And, to start off, I'll give kind of a broad definition to what chiropractic care is. And then as we kind of get to talking, we can elaborate a bit further. But, at its foundation, chiropractic ensures that our bodies function optimally, whether that be mechanically through our muscles and our joints, or viscerally, our organs, how they function. Everything in the body is controlled by the nervous system, which is housed by the spinal column. So ensuring that's in proper alignment is going to ensure that the body is optimally designed and is working as efficiently as it can.
Mm-hmm. And I remember the first time, I didn't even really know what chiropractic was, and then I was getting a little sports massage at a competition I was at. She's like, "Oh, your spine's misaligned. You should really go see a chiropractor." And I'm like, "Oh, I don't even know what that means." But Sonny was a member at the gym I was going to, so I talked to him and went and saw him, and that started, a 4-year relationship. Very cool.
Yeah.
I was the typical got hurt, and then I was like, I should go get this checked out.
Yeah. Well, you're not alone in that. Most people, they wait kind of towards the end. And the thing I tell a lot of patients and people who are new to chiropractic is oftentimes by the time symptoms have onset and you're really starting to feel it, well, the problem's actually been there for much longer than you may have realized. And at that point, we got a lot of work to do to get you back on track to doing the things you like to do and, performing, like I said earlier, at your best.
Mm-hmm. So that brings us to one of our questions then. What should somebody be doing for regular chiropractic maintenance, or what do you guys recommend?
So that's a difficult question in the sense that everybody is different, right? Someone's maintenance schedule may not coincide with someone else's maintenance schedule. It has a lot of factors, age, your activity level, how much damage has already been done to your system when you first come in, and we kind of evaluate you. But it's important to maintain your spine and your body. You got to think of your body as a machine, and just like any other machine, a lot of moving parts. If you don't maintain it, it's going to break down over time.
Mm-hmm. This is something you can kind of speak on. Like I said, I went before I was injured. Most people associate chiropractic care with, you get hurt, you're in pain, you go and they fix the pain. So everyone asks me, did it work? Like, I've been going to get chiropractic care, did it work for me? And they're expecting me to say, well, I had pain and now it's gone, so it worked. I always say, well, I didn't have pain, so I can't
give you that black and white answer. You know, it's not as easy as saying my pain went away.
Yeah. And that's the thing too. When you're on for maintenance, the way, especially you guys, very active with your joints, with your muscles, things like that. The way I often iterate this concept to people is think of your body and your muscles like a pulley system, right? Your muscles are always kind of constantly tugging on the bones and the joints, helping them move as they're designed to. However, say, you know, a cable machine, things like that. If those pulleys, think of those as your joints. If those are misaligned and then they're not in the proper fashion they should be, well, you need a lot more effort, a lot more force through your muscles, in this analogy, to move that weight. But if your spine, your joints are in proper alignment, and those pulleys are in alignment, well, then you require much less force from your muscles to help you lift that heavy weight or do that last rep.
Makes a lot of sense.
Yeah.
Cool.
I will say that because I was the one that got injured and then went, like, yeah, it helped me and it helped my pain. But one of the biggest things that has kept me paying attention to over the last couple of years is just, like you said, kind of like where my muscles and joints are. Like, I can tell when I'm starting to get stiff and I'm heading towards an injury for the most part. And I'll be like, oh, that's not moving the way that it's supposed to. Or, you know, when I do get chiropractic care, like, if it's a harder time trying to align my back or, you know, all of those different things, then it's a warning system, like, watch out, going down the wrong way.
Yeah, absolutely. And that's actually how I kind of know when I need to be adjusted. You know, patients often tell me after an adjustment that they feel much more lighter, right? And that's because if you think about it, well, your joints, your support system is your spine, and your skeletal system is in the way it's designed to be to ensure that, you know, the least amount of effort is being displaced to help you stay upright. Whenever I feel like I have to really kind of, you know, sit up tall or exert a lot of energy to maintain that good posture, well, I probably need to go get checked and get an adjustment.
Oh, that's great.
Can you tell us a little about ART? What ART is?
Sure. ART is it's an acronym. It's active release technique. And at its simplest definition, essentially, it's shortening a muscle that may have an adhesion, like a muscle knot, or the fibers just aren't gliding the way they should. So you shorten that muscle, apply a specific pressure to it, and then lengthen it so that it can slide past the adjacent structures. Whenever you have adhesions in your muscles, it can create a number of things, right? It can cause that unequal pulling between the adjacent fibers, which over time, over a lot of stress and force, can lead to injury. Not only that, but when you have those adhesions, it leads to something called hypoxia, which is decreased oxygen, blood flow, circulation in that muscle. Over time, that can further increase your disposition to getting those injuries because your muscles aren't getting the nutrients they need to repair themselves. So, interesting. Yeah.
So when do you typically use that with someone?
It's a kind of analyze and then treat as needed. Not every person's going to need some ART care, but that's part of my workup, right? If someone comes in for neck pain, let's say, I will run them through some range of motion tests, see how well they're moving, turning their head left and right, bending left and right, et cetera, et cetera. And then once I analyze the spine, adjust the subluxation, as we call it, then I'll work the muscle tissues in that surrounding area to ensure that they're getting relief from that muscular tension. And then also so that muscle doesn't tug that vertebrae right back out of place because it's in that shortened, tight state.
Right. Cool. So we can kind of look at that maybe like how if we have a new person who comes in the gym, you know, we're going to analyze them first. And first step is we're going to make sure you're just moving right before you touch any weights. Then if we're comfortable with how you're moving, then you can use a barbell, and then, you know, you can advance as you're going.
Absolutely. Yes, same exact concept.
I think that kind of brings up one of the biggest things that I deal with talking to our members a lot and giving out your guys' cards when I hear people saying something. A lot of people, when they are injured in the moment and their back's out of alignment and they're not maintaining their chiropractic care or mobility for that matter, they will come to me and they'll be like, oh, you know, who do you suggest? And I'll explain to them who I suggest. And they're like, okay, do you think that they can, A, get me in tomorrow? B, will they adjust me right away? Mm-hmm. And I usually have to tell them, I'm like, that's not really how it works, because it's kind of the same thing of what we do in the gym. we have this consultation. We go over like what's going on, what are your goals, what are some of the things you're looking to achieve, and we talk about all that, and then we have a beginner's class, and then they go into class. And I feel like that's kind of how the chiropractic care is. If I was just injured and you had no idea who I was and how my body moved and wanted to adjust me, it's probably not going to go very well.
Yeah. I mean, you got to, just like you said, Corian, you guys got to take in the data, however anyone comes in, analyze it, and then you're doing this ultimately for the client or patient, whoever's coming to see you, and you take it seriously. Mm-hmm. So if you were to just go out there and, in your guys' instance, tell them to lift this weight, or me just go in there without really thoroughly analyzing the x-rays, the exam findings, and just perform an adjustment, well, I'm not taking that much precaution into their care, when in reality, we're both dealing with very sensitive structures, muscles, the bones, and the surrounding structures, the nerves. It's great care, precaution, and planning needs to be taken. So oftentimes, it's going to take, a visit or two before we really get in there and start making the results happen.
And that's why setting it up when you're healthy is a big step forward, because then even if you're going like once a month or once every other month, that's not always ideal for everybody, but there's a relationship built there, and a better understanding, so that when I come in, you're going to be like, whoa, Corian, this isn't typical.
Oh, yeah.
Let's look at this.
Yeah, and I say that on my my day 2 with patients. I'm like, hey, I've only known you 2 days. I don't know how you heal or how you respond to care, but we'll learn this throughout the course of treatment, and it takes about a week and a half or so before that comfortability is brought to a level to where both parties can really thrive, and you really start to get traction and see some cool improvements happening.
Wonderful.
Cool. So tell us kind of why chiro is important. I know we kind of just hit on a lot and kind of touched this a little bit, but why you think chiropractic care is important for everyone?
Well, like we've been talking about, from the musculoskeletal standpoint, it's important that your body as a machine functions as efficiently and effectively as possible. But the underside of chiropractic care, which a lot of people don't realize because they haven't been educated on it, is that whenever you have a bone in the spine, a vertebrae, that subluxates or misaligns, what it does is it puts direct pressure on the nerves that exit the spinal cord at that particular level, okay? And nerves don't like to be irritated. Case in point, hitting your funny bone, right? There's nothing funny about it. It's quite unpleasant. But when that happens in the spinal region, it affects whatever that nerve goes on to controls. For example, I've defined T6. That controls the stomach. If someone has a subluxation at that particular area, well, that nerve starts to act up, starts getting irritated. So it'll send more nerve signals than it's designed to, just like when you hit your funny bone, okay? Well, that tells the acid-producing cells of your stomach, well, I got to produce a little bit more acid. So people often come to me with symptoms of acid reflux, heartburn, that type of thing. Throughout the course of adjusting, getting that bone back into position, alleviating that nerve pressure, it's often the case I find that those symptoms of acid reflux either greatly diminish or in some cases are completely gone from that person. So it affects all structures of our bodies, all aspects of it, not just our muscles and our bones, but our viscera, our organs, our moods, our headaches, that type of thing.
This is my favorite thing to talk about ever. I love talking about like how everything affects everything else. So somebody was explaining to me that their IT band was acting up and it was bothering them really bad. And we had just gotten done with a workout that would, for me and a lot of people, does their arc of their foot, wall balls and burpees and double unders all together. And I'm like, you might be feeling your IT band, but really it's probably from the arc of your foot, which is like pulling on your posterior tibialis tendon all the way up through your knee and then through the IT band. And they're like, oh, it's so crazy. Yeah. And just like how everything kind of just reacts with each other and how it all works together just is like mind-blowing to me.
Like all the muscles of the body are connected to one another via, fascial planes, or that connective tissue that helps keep everything together. So, if you think about it, it's not so hard to believe that a shortened muscle in one area of the body can cause just that long chain reaction and affect something, maybe it's in the foot, could actually be affecting the neck.
Yeah.
That's another possibility and aspect as well.
Yeah, and I explained this to my class today. We had pull-ups, and I was saying, sometimes I see a lot of people when they do a pull-up or kipping, they arc their neck, trying to reach their neck over the bar to try to get that extra length. And I was telling them, pick a spot on the wall. Don't do that because your spine acts as, your central nervous system runs through the spine, obviously. And I was like, so when you arc your neck, you're putting a kink in the spine, which then you lose power in the arms, which you actually have to work harder now And I was like, think of it as like a hose. It's spilling water. And I was like, if you put a kink in the hose, the water may still come out, but it's not going to be as good. And then I had somebody do a pull-up, and they did that, and they were like, oh my gosh, I got higher than I've ever gotten. I'm like, well, imagine that.
It's the exact same analogy I use for nerve pressure as well. Yeah, it's just that plain and simple, really, when it gets down to it, you know. But not only does your brain need to communicate with your body, but the reverse is true, right? Your muscles have to communicate with your brain. And the thing I often tell patients, for example, sprained ankles, right? You always hear whenever you sprain an ankle, it's much easier to recur and have that injury. That's because if you don't rehab that, the connection between your ankle and your brain is deficient. So if your ankle starts to roll over and possibly sprain, your brain can't tell that outside leg muscle to contract and try and save and protect your ankle. So it's just as important that you rehab the muscles appropriately as well so that you can prevent injury. So yeah, there's you gotta look at it from a bunch of different aspects. It's a fun topic to talk about.
Wow.
And this is why we partner with people who know this stuff, because like, you know, we like to think we know a lot, but in these domains we don't have as much expertise, you know, as like you guys will over there. And that's one thing we're always very quick to do is if we know something's not in our realm of expertise, we're going to get someone who knows for our clients.
And I think a lot of people just expect, like, I deal with this a lot with like nutrition and obviously the gym, but people are like, well, there's just so much information. And like, yeah, we can't know it all. That's not the point. The point is knowing where to go to find things out, though.
Absolutely.
You know, who can you talk to? Who do you trust? You know, what can you read? You know, all of those sort of things. And I think that's what we're trying to do here is like build this community of people who have these expertise, because like Jason said, we don't know it all. And so, you know, when we have someone that has an issue, I can be like, this is the person that I trust, and they're going to help you.
And that's, you know, just same thing within the healthcare profession. Not one healthcare provider can do it all or knows it all. And, you know, the great thing about you guys here is you guys deal with the public. So a lot more even senses that I do. Right? So the better I'm able to inform you guys, well, you guys are almost like the vessel. You're telling the public, giving them the right information so that they can make those good choices, those good lifestyle decisions so that we can all lead a more, you know, healthy, balanced life.
So let's kind of parlay that into our next topic here. What do you think is like the most common, when you're working with CrossFitters, like the most common injury you're seeing?
It's between two. I can't really narrow it down to one because neck and back are pretty much, neck and low back, I should specify, are pretty much the two common ailments I see come through the door. And especially with CrossFit, you know, a bunch of compound movements, you're seldomly isolating just one muscle group. You're using your whole body, right? So you got to make sure that balances are pretty much present between your muscles throughout every aspect of your body. But as far as CrossFit, I would say almost neck, because a lot of the overhead presses, people kind of do, Dave, what you're saying, that they alter their neck position. A lot of people stick their head tremendously forward, which does the same thing, puts a lot of pressure on those lower cervical discs, which can lead to injury, you know, on down the road, things like that. So I'd say neck, but low back is a very close second. Yeah.
Interesting. And any thoughts from your end on how people, you know, other than just coaching them better and correcting, can try to mitigate those? You
know, posture. It's, you know, that's not just something your parents always harped on you for when you're a kid. Posture is huge. It's the things, the small things that you implement into your daily habit, your daily routines, that over time are going to produce large dividends. So making sure you're sitting upright, you know, keeping your head over your shoulders, not slouching or rounding the low back when you're sitting, you know, obviously doing your big heavy lifts is going to ensure that you're less inclined to go through those injuries or have a far less prevalence of developing those injuries.
Oh my God, that's kind of what we talk about all the time. We talk about like daily when we're working out for everybody, like your goal is to have great form. And if that means that you have to move a little bit slower or you have to do a little bit less weight, then that's the important part, because we're getting those muscle memories and those habits and those routines. And then if you ever decide that you want to compete, or maybe there's a moment in your life where you have to lift something, you know, or do something outside of the gym, and maybe you're not as warmed up or you're not prepared for it, but your muscles are used to it, like that one time's not going to hurt it as bad. But when you're constantly doing these poor postures, these bad movement patterns, it's going to build up a lot, and it's going to cause those injuries way faster.
Patience is a virtue. I mean, we like, all your clients and all our patients, they're enthusiastic. They want to see those progresses, those gains and things like that. But, if you instill the wrong habits and the wrong, muscle imbalances from the get-go and then build off that, well, it's a heck of a lot of backtracking you got to do to then even get back to where you were or surpass, that heavy weight that you were lifting with that poor form. So it's always better just be patient in the beginning, do the things you're supposed to do, and then eventually, you'll really start to gain traction and progress.
Yeah, for sure.
I'd really like to find more ways for our members to kind of measure their success in those realms, so that like when I deal with all my health coaching clients, it's all about scale. What's the scale say for my journey? And I'm like, it's not about that. Like, how do you feel today? Some of the symptoms you came to me with gut issues or acne or headaches, or, how's your clothing feeling and how's your energy level? How's your sleep? So we build on all these other realms for tracking our progress. And I think that in CrossFit and with chiropractic care, if you had more than one way to measure that, I think that more people would still see that progress and be happier with those, habit building routines.
Absolutely. Just seeing that from a different perspective, like you said, I can see it. You guys can see it performance wise, and I can see it, physically from a structural aspect. Swelling in your low back is decreasing. This muscle isn't as, spastic or isn't as tight in your low back. How are you feeling? Things like that. And then when you have that relationship between multiple healthcare professionals, people in the health and wellness environment, that's when you're going to get the best outcomes for the people, because they get that kind of conference and bounce back off multiple people telling them they're progressing.
Yeah.
So I have an interesting kind of idea here that maybe you can speak on. So kind of off Corian's point, like in the gym, what we find is people gravitate towards weightlifting stuff because it's much easier to see improvement. You can see your weight on the barbell went up week after week. You're progressing, where in the gymnastics side of things, it's a lot harder because you don't have that set increment. It's kind of like, it's just hard to tell if the progress is there. So I can kind of see maybe the same thing, like if a patient's getting treated but the pain's not going down, they could still be progressing in other areas, but they're just thinking like, well, my pain's still there, so it's not working.
Yeah, absolutely. I mean, that's, pain's the last thing to show up in any sort of dysfunction. It's the first thing to go away. So oftentimes, like I said earlier, when you're at the point of pain, it's the red alarms are going off. There's a crisis in the body, and oftentimes it takes a bit. People have to be patient and kind of learn to see progress from different aspects, like the gymnastics portion. They might be able to have more mobility in their shoulders, or, their shoulder blade is moving out a little bit more as they raise their arm, that type of thing. And unless those patients are instructed to look for those, or the clients are instructed to look for those type of things, they're not going to know about it, because that's why, it's important to tape your form, things like that, because you catch a lot of things that you normally wouldn't. So.
Awesome.
One of the things I'll end with my chiropractic care, I notice too, when I do have a slight injury, because I do see you guys regularly, and make sure that I'm weekly or bi-weekly, I notice that if I have a little tweak or a little injury, I repair a lot quicker. So I go to you with like, hey, my shoulder's kind of messed up. You guys do a quick adjustment or some ART, and then my body goes back to where it's used to being, as opposed to, like you said, the poor posture. If I'm always in poor posture, that's where my body's used to being. But because I see you guys and I'm working on it, it helps.
And that's great. And, like Corian said earlier, it's a community thing. We got to ensure that all aspects of the, the bigger machine, all the gears are turning, that people are able to provide for the community, to give back. So we're always happy to do that.
Right. And obviously, if you're seeing someone routinely, when those tweaks come up, you know the body, and you can get them right away, kind of like Dave was saying.
A lot quicker.
Yeah. Cool.
So, Dr. Tyler, where can our members find you?
You can find us at 5024 Green Bay Road in Kenosha, Suite 100. Big giant sign that says chiropractic on it. You can't miss it.
Right next to Quick Trip.
That's right.
That's usually where I tell people, what Quick Trip's at?
And we have our Wellness Saturday coming up. This is going to be
Tyler's
before
going to be there, I believe.
that, cool. Right? Because that's this Saturday, and this is coming on Friday.
Yep. So this will be out on Friday.
If you have any other questions from hearing us talk today, bring them on Saturday. I'd be happy to answer for them.
Do you have any questions for us before we wrap up? We asked a lot from you.
Yeah. No, that's, you guys, I've known you guys quite a bit. You guys do really, really great. For example, how often do you guys normally implement a training regimen or things like that? For any type, someone maybe looking to get into CrossFit. I have a lot of people that come to me and ask me what I think about it, and I was like, well, it's great. It's for everybody. Everybody can really benefit from it. So anything you guys can give me to...
Yeah, so like, you talk about like our program and kind of like...
it's something I can just kind of spoon feed a little bit and then refer to you guys.
Yeah, the nature of our program is like we don't do cycles, and we don't kind of like, our goal is to have something that's going to make our clients slowly progress for the rest of their life. So really, when someone comes in new, we have them do a beginner class where they can learn the stuff, and then they hop right into that slow progression, which is just our normal programming, the normal class. The goal is for them to improve very, very slowly over a very long period of time. And obviously with that, our coaches know a ton, and they're going to kind of help the client make sure they're doing things smart and safely, and coaching when needed, and modifying and all that. So yeah, it's really kind of, they come and they get started, and then they get on that track to improving their health and wellness.
So to add on that a little bit, like I said earlier, the first thing that we do is we do a consultation. So they just contact me, and I do 90% of the consultations, either Racine or Kenosha, depending on where they're looking to go. And from there, we sit down and we address like what they've been doing, what they're looking to do, any injuries that they might be coming to us with that we want to know about right away. And then we talk about what the program entails and how it's going to benefit them for their goals. And we really kind of break it down. Like, a lot of people obviously come to us and they want to reduce health risk markers, high cholesterol, pre-diabetic, or any of those issues. So we talk about all the programs that we offer, such as we talk about nutrition, we talk about the camaraderie with the community, surrounding yourself with like-minded people. And then we talk about how the program and the classes run and how that's going to fit into what they're trying to do. And then from there, after they get started at about 6 weeks, I sit down with them again. Now that they've had an opportunity to get into classes, how do you feel? How are things going? If they did come to us with an injury or an injury occurred, they meet with Dave during that time so that he can make sure that they're moving properly, see if they need to come see you or anybody else. And then at 6 weeks, we reevaluate those goals. And then from there, we try to schedule every 3 to 4 months to keep doing that touch base with them. And like, did your goals change? Or are what we're doing just not getting you to where you want to be? And then how can we adjust that? So one of the biggest things is the goals are generally always the same. But like you said, everybody's different. So trying to find the path to get to that goal is where like that bread and butter comes from. So that's what I do.
Awesome.
Yeah.
Yeah, no, I like that thoroughness.
And then I'm just going to piggyback off of what Corey said with the injury stuff, because I know that is a big concern for a lot of people. Like, oh, you've heard some horror stories, and CrossFit sometimes does have a negative connotation about it. So we've done a really, I guess, over the past 2 years, really tried to revamp how our injury protocol is, because we want to make sure that we're helping people be healthy for a long period of time, like Jason said, for a long period of time. So, when they come into us and somebody's like, well, I have had previous surgeries, those things are things we need to know. Or if they already have an injury, I do all the injuries in the gyms, both of them. So I meet with that client. So Corey will set up a consultation with me. And then if, let's say, Tyler, you had a shoulder injury, I'd go over that with you and say, okay, what's going on? What prevents you, or what triggers the pain? Just try to figure out if it's more musculature or if it's going to be like a weakness where that maybe it's just like, okay, you're developed, you're not really, the muscles haven't developed right. So we have to kind of build off get you stronger in these areas. So if it's that issue, then I just modify most of the workouts. So you'll get a weekly modification plan that you will follow, sent right to your email, and you have direct contact with me. And then I set up another 6-week follow-up and I follow up weekly, but then at 6 weeks, we're going to sit down again, go over that. But if it's something where somebody comes to me with an injury because they tweaked their back in a workout, or